Hello, this is Fred Kusumoto reporting to you from Madrid from the European Society of Cardiology. This is the first of 4 daily wrap-ups that is going to be part of the ACC coverage of the meeting. I'd like to highlight a couple of different trials that were presented at the hotline here today. The first is a trial called Podcast. Fascinating study, taking patients who had an ICD and a low potassium of 4.3 and randomizing them either to usual care or trying to then follow them and monitor them to keep their potassium between 4.5 and 5.0. And after follow-up, those patients who had that intensive potassium monitoring, keeping them at a higher level of potassium, in fact, had a significant reduction in their composite endpoint, which was mainly driven by the use of appropriate ICD therapies. So, for example, those patients who had that higher potassium target, in fact, had reduced appropriate ATP and reduced appropriate shocks. This is a fascinating study, and it shows that something very, very simple can lead to very important changes, and one wonders whether or not this is something that could be generalizable more broadly. The second study is digit heart failure. This is a study of 1,200 patients with heart failure with reduced ejection fraction with different criteria based on their heart failure symptoms. But after about 40-month follow-up, those patients who were randomized to digitoxin were in fact associated or had reduced heart failure hospitalizations and overall mortality, really with both in fact showing a benefit. Again, it's important for us to remember to not conflate, in this case, to the use of digoxin. Remember that digitoxin and digoxin are excreted in different ways, whether by the liver or by the kidney, respectively. So again, we'll have to wait for decision to see if, in fact, these sorts of results are transferable, in fact, to then those patients who are receiving digoxin therapy. But it is exciting. I mean, I think of digoxin. I remember how important it was when I first started training. It went through a lull, and now it seems to be going through a renaissance where we use it. The last trial is Amalfi. Again, an interesting study where they took patients who were older and at higher risk for stroke and randomized them either to usual care for identifying atrial fibrillation or a 14-day recorder. Not surprisingly, those patients who had the 14-day recorder mailed to them had a higher incidence of atrial fibrillation, but it wasn't much. It was 6.8% versus 5.4%. Really striking and important in the fact that the main takeaway, at least for me, is that we're getting a little bit more cognizant of the importance of identifying atrial fibrillation, whether it's us as healthcare providers or our patients. And I think that this is going to be important and may attenuate the impact of wearables and other types of methods for identifying atrial fibrillation early. I hope you enjoyed this first daily wrap-up. Join us tomorrow as I am joined by Eugenia Janos, and we're going to really focus on the prevention aspect for the Hotline 2s. Take care now. Bye-bye.